Our second speaker is Dr. Fred Sai. He is a Ghanaian family health physician and director of the Women Deliver Board. He chaired the main committees of both the UN Population Conference in Mexico way back in 1984 and the International Conference on Population and Development in Cairo in 1994. Dr. Sai will speak of inaction on family planning in sub-Saharan Africa for precisely 6 minutes. You have the floor, Dr. Sai.
Thank you, Chair. I'm glad about how the timing gets changed. You may have noticed I'm quite old now, probably a bit too old to be standing up and talking to you. But I'm grateful for the opportunity at this stage in my life to continue to share my story about my passion for reproductive health issues with you. My story starts when I was very young. My father died when I was 3 or 4, and so I was brought up mainly by women, particularly my mother. I stayed in the women's compound in Osu, a suburb of Accra, Ghana, a bit longer, therefore, than ordinary boys of my clan would at that age. I was about 10 years old before I left my mother's compound. I was surrounded always by girls and my powerful aunties and my mother. My first memories are of these women talking, laughing, working, and impressing on me how rich the company of women can be. In 1947, I left my beloved country and went to study overseas to Britain, to study medicine and public health in Harvard. It was such a difficult time in Britain in the 1940s and 50s, especially. With respect to contraception, not even the condom was available very readily. I saw the result of this restriction. There were girls, overseas students like us, who had gotten pregnant and could not face it and had gone to unskilled providers. Some had been helped. A couple of them had died, and one had attempted suicide. These were my first inklings that reproductive justice was the basis of human rights for women. Back home in Ghana in 1970, the country became the first in sub-Saharan Africa to launch a family planning policy. I was thrilled at the time, hoping it would lead to real fundamental change in the lives of the women of Ghana, in the lives of those little girls with whom I had grown up. And yet, 43 years later, I'm sometimes sad and disappointed to see how slow our progress has been, that the contraceptive prevalence rate is still around 25%, and that's for all methods. The unmet need for contraception in Ghana is over 35%. These figures may appear fairly reasonable compared with other West African countries, but they are behind some in East and Southern Africa and well below international averages. In fact, practically all the last 10 countries with the worst statistics for maternal and newborn health are in the sub-Saharan Africa region. The lack of family planning is a major contributor to high levels of unsafe abortion, high school dropout rates, and high maternal mortality. Without the ability and capacity to plan pregnancy and births, girls and women are completely handicapped in planning any other aspects of their lives. One of my assignments as a young doctor when I went back home was to conduct autopsies, or postmortems as they are called somewhere, in some places. I saw the most horrible things on those slabs, things I will never forget as a result of botched abortions. As much as I would never wish to inflict these images on anyone, there are times when I have wished there were an equivalent way to translate the emotional impact of our unfinished resolution on others. Since then, too many girls have died. Too many have suffered greatly, and too many have fallen short of their potential. But the good news is that things are changing. And I am happy that it is still possible that as I stand here, old Fred Sai, I can still believe in the inevitability of the change. Today, many more African leaders understand the urgency of addressing the maternal health crisis, despite the complexity, than they did in 1970. They understand the broader impact maternal death has on their countries and the country's women. Women are the heart of African economics. They transport 2/3 of all goods that are moved and produce 60 to 80% of food in all the developing world. And maternal and infant deaths account for 15 billion in lost production every year. But positive change has happened and continues to happen. The number of women who die every year in childbirth has dropped from the 500,000 to less than 300,000, and it is continuing to drop. I am happy to see progress being made when I am alive, but I still have to ask, where is Africa? Where is Ghana? A recently published study by Save the Children's Fund shows how slow progress is in sub-Saharan Africa. I believe that the success of African leadership in the decade should be judged first and foremost by the progress made in the lives of our girls and our women. My credo, in which I would like to ask you to join, is we should say no more unplanned pregnancies in Africa, no more unsafe abortion in Africa, no more preventable childbirth-related deaths in Africa, and no more women should ask for family planning and not get it in Africa. Many people ask me, what is it that makes you so passionate about these issues? My answer is, I am afraid to die. I think if I die too soon, I will be judged by the failures. And so I continue, to the extent that my little old heart continues beating. To that extent, I will still passionately advocate. I will work with the spirit of the women and the girls of Africa. They deserve no less. Thank you very much.